Delayed, but House Democrats are still pushing to vote on their sweeping health care overhaul bill this weekend. If the Democrats do pass the bill, what will Wall Street wake up to on Monday? Gary B.
Start of a declining economy, that's for sure. You know what's in this bill, Charles? It's just nothing but it's a veiled attempt to raise taxes. You know, if you're a small company, you have a $1 million company, you're going to face marginal tax rates of 45%. And by the way, they're not even indexed to inflation. Oh, by the way, if you don't offer health insurance, you got an $8,000 surcharge. This is going to kill small businesses, and you know what that's going to happen, Charles? It's going to kill the economy. This is the worst bill ever, and I paraphrase from the Wall Street Journal on that one.
Yeah, Mark, you're already bearish on the market, Mark. Would passage of this bill make you even more bearish?
I think this is going to be very good for the market, and I think it's going to be very good for the economy. I think it's going to be good for small business, and you know, it's going to allow us, if it's going to allow us to basically employ all those people that Jonathan thinks should be creatively destroyed.
But Mark, let me just find out.
I mean, I see a rally out of this bill.
Hold on one second, guys. Mark, I need to understand though. What do you think is going to, if this is passed, why would Wall Street celebrate on Monday?
I think Wall Street, I think this will be very good for healthcare providers, device makers, nursing homes. It's going to be very bad for the insurance companies. Boo-hoo. I don't care about the insurance companies, so what?
Mark, if this passes, that means that the idiots are officially in charge. That's what it means. This is doomsday for Wall Street. This is not passing, first of all.
You guys sell doom and gloom, and it's not true.
Hang on. They haven't come to terms on the abortion language. Illegal immigrants. There's just a lot of language in that bill that even the Democrats don't agree on.
This is Nazi scarism.
They do not have that 218 vote that everyone seems to think is going to be a layup. At least
it's total
Steny Hoyer does.
From
it is
the
not a layup.
Mark,
even the Dems are turning on this.
Jonathan?
Well, you know, Mark is right that you know, this bill and all these bills, with Pelosi bill, Baucus bill, does put more and more choices about how healthcare is administered, how it's paid for. It puts all those choices in government hands. So yes, Mark, you're right. Some companies will do well, but that's the point. But that's the point. You're going to have, once again, the government in the position of picking winners and losers and picking.
Now we have the market in the position, and a lot of people don't have insurance.
Well, obviously, you trust the government with all of its prior successes in Medicare and Medicaid more than you do individuals to make your own decisions about
all its prior successes in housing and other things. I mean, come on. I could pick as much as at the market as you pick at the government. So
you can't find
the market's not perfect either. I
defy you to find one thing the government has run well, Mark, especially
your I think Social Security runs pretty well.
Oh, come on,
I think the post office runs pretty well.
I
think the interstate highway system runs pretty well.
This year, Mark, and that's a real terrible example to use, because at the end of the day, if this bill doesn't live up to the hype, that money's got to come from somewhere, and I think Americans know if you work that it's going to come out of their pockets.
Well,
it does, but right now,
Charles, don't forget one thing. You know, we're talking now as if the cost of this bill at $900 billion or $1 trillion or whatever it is going to stay the same. We know what happened with Medicare. We know what happened with Medicaid.
Right.
10
We're already
times
paying
over
for this
estimates.
bill. We're already paying for this.
Right.
Yeah, we're going to pay 10 times more because it's going to be run that less efficiently.
Jonathan,
and that's just it. And that's just it. I mean, Charles, I'm worried about the market, yes, but I really am worried about the health. And with all due respect, Nancy Pelosi and Steny Hoyer, they don't see the long-term consequences of what entitlements like this create.
Tracy, what do you make, though, the notion that this administration is so anti-business that if this does go through, Wall Street's going to be extremely nervous?
Good.
How could you say good? I want to know what planet you live on some days, Mark. Come on. This stuff is killing capitalism left and right.
It is not killing capitalism.
Mark, do you have children?
It's actually going to help rebirth capitalism.
Mark, do you have children?
This is a thing that is a good thing. It is for renewal.
Do you have any kids? Because if you
I do not have any children,
but
then
that's
the
why
issue?
This doesn't hit home, because my children will be paying for you thinking that this is a good bill right now. It's ridiculous.
What about all those people who are laid off that don't have health insurance, that are not making a lot of money?
So we should just put the burden on kids. That's what you're saying.
Hold on one second. Now, Mark, are you suggesting that if this bill is passed tomorrow, people will have jobs on Monday?
The sun will come out, Charles.
I'm suggesting that they'll have health insurance and that entrepreneurs will be willing to go out and start businesses.
First of all, what about the notion, though, that we should be focusing on job creation? You know, really, for someone sitting, a lot of people on welfare have access to medical health. That doesn't help them economically, though.
Right.
But Charles, this is going to lead to an expansion of jobs for many different reasons.
Guys.
It's going to help the guys at the bottom of the ladder.
A lot of fun, guys. Gotta let you go.
Because people are going to die under this plan,
Tracy's got to go home to her kids.
Available jobs.
Have a great weekend. By the way, the real